Question number 1. The child is admitted to the pediatric ward with acute lymphocytic leukemia and has had joint pain for several weeks. Physical findings include widespread ecchymosis, generalized lymphadenopathy, hepatosplenomegaly, and pallor. Lab work shocks a low hemoglobin level, RBC count low WBC count, low hematocrit, and low platelets. Which high risk is expected? Options: Option A, infection; B, fractures; C, dehydration; and D, hepatitis. So here the correct answer is option A, infection. Okay. So the bone marrow that is infiltrated by malignant lymphoblast that is leading to reduction in normal blood cells production. So that will lead to the low levels of RBC, that is also called as anemia, and the decreased WBC count is called as leukopenia, and the platelet count is also low. Okay, that is also called as thrombocytopenia. So these three conditions is involving. Okay, so that will make the child susceptible to infections. The combination of immunosuppressive and low platelet count, okay, that will decrease the risk of infections in children with leukemia. Question number 2. A woman who has been discharged from hospital with a permanent colostomy inlays is performing irrigation at home for the first time. After 5 minutes from the start of the procedure, she begins to have stomach cramps. Which intervention would most likely decrease the symptoms? Options: Option A, increase the flow of irrigation solution; B, decrease the temperature of the water; C, clamp the catheter for 1 to 2 minutes; and D, elevate the bag of irrigation solution. The correct answer is option C, clamp the catheter for 1 to 2 minutes. So clamping the catheter for 1 to 2 minutes can allow the bowel to adjust to the instilled fluid and may elevate the cramping. So this interruption in flow that gives the bowel time to adjust before resuming the irrigation. Question number 3. Which of the following is the most common site to obtain a capillary blood sample from neonates? Options: Option A, heel; B, earlobe; C, fingertip; and D, hand. So here the correct answer is option A, heel. The most common site to obtain a capillary blood sample from neonates is the heel. This area is often used because it is accessible and has a sufficient blood supply. The heel sticks is a common method for collecting small amounts of blood for various tests in newborn. Question number 4. A 38-year-old quadriplegia patient discharged from the hospital in order to prevent contractures of all extremities. The nurse will instruct the patient's wife to encourage his husband to perform which type of exercise? Options: Option A, active range of motion exercises; B, passive range of motion exercises; C, active assistive range of motion exercises; and D, resistive range of motion exercises. So here the correct answer is option B, passive range of motion exercises. So the passive range of motion exercises, that is, help to joint flexibility, prevent stiffness, and minimize the risk of contractures due to immobility. So active, assistive, and resistive exercises may not be appropriate in this situation where the patient is unable to initiate or participate actively in movement. Question number 5. A nurse is teaching a group of mothers in the postnatal ward how to manage breast engorgement after they are discharged to home. Which of the following statements by the mother will indicate to the nurse that they understood how to prevent engorgement of the breast? Options: Option A, breastfeed every 4 hours; B, breastfeeding during the day and bottle feeds at night; C, breastfeed every 2 to 3 hours during the day and stop at night; and D. Breastfeed the baby every 2 to 3 hours during the day and night. So here the correct answer is option B. Breastfeeding during the day and bottle feeds at night. So this statement indicates an understanding of frequent breastfeeding, which helps to prevent engorgement by maintaining milk flow and preventing excessive breast fullness. So breastfeeding every 2 to 3 hours during both the day and night is recommended in the early postpartum period to establish and maintain milk supply and prevent engorgement. Number 6. The nurse is assigned to care for a patient with Paget's disease complaining of bone pain. Which of the following conditions the patient is at high risk? Options. Option A. Hypomagnesemia, B. Hyponatremia, C. Hypercalcemia, and D. Hyperkalemia. So here the correct answer is option C. Hypercalcemia. So the Paget disease, that is a chronic disorder that affects bone metabolism, leading to the excessive breakdown and formation of bone tissue. The increased bone turnover can release calcium into the bloodstream and contributing to elevated serum calcium level. Question number 7. A 22-year-old man present to the mental health clinic with a low mood, a general loss of interest in activities, and inability to experience pleasure. He admitted to suicidal thoughts and extreme lack of energy. He was prescribed a selective serotonin reuptake inhibitor to be taken daily. 1 month later, he presented to the clinic and reports feeling more energetic but still has a low mood. What is the patient's level of risk committing suicide at this time? Options. Option A. Low, B. Medium, C. High, and D. None of the above. So here the correct answer is option C. High. A high level of risk indicates that immediate and intensive intervention is necessary to ensure the safety of the individual. Suicidal ideation and persistent low mood are serious symptoms that require prompt attention and appropriate mental health care. Question number 8. The nurse is assessing a child, an infant, with pyloric stenosis. Which of the following is likely to be noted? Options. Option A. Diarrhea, B. Projectile vomiting, C. Swallowing difficulties, and D. Current jelly-like stool. So here the correct answer is option B. Projectile vomiting. Pyloric stenosis is a condition in infants where there is a narrowing or obstruction of the pylorus, the opening between the stomach and the small intestine. Projectile vomiting is a common symptom of pyloric stenosis. The vomiting is forceful, typically occur after feeding, and can lead to weight loss and dehydration for the baby. Question number 9. A diabetic mellitus patient had left low knee amputation. The nurse in the surgical unit has been doing wound care for 3 days. The nurse evaluated the wound's condition to review the care plan. Which sign shows poor glucose control in wound healing? Options. Option A. Swelling of the stump, B. Bleeding of the stump, C. Mild redness of the wound site, and D. Separation of the wound edges. So here the correct answer is option D. Separation of the wound edges. Separation of the wound edges is also called as dehiscence, can be a sign of poor glucose control in wound healing, especially in diabetic patients. So diabetes can impair the normal healing process by affecting blood flow, reducing the immune function, and impairing the collagen formation. So the poor glucose control can lead to delayed wound healing, increase the risk of infection and compromised tissue repair.